Good morning, my name is Ushin Walker and I'm here today to do an insertion and the removal of a Foley catheter on a male patient. So as I enter the patient's room, I'll create privacy. Then I will do hand hygiene. After hand hygiene, I'll go and introduce myself to my patient. Hi, good morning. My name is Ushin Walker, I'm your nurse today, and I'll be doing an insertion of a Foley catheter. Can you provide me with your name and date of birth, please? And whatever the patient tells me should match his armband. Okay, thank you, Mr. Livingston. How are you feeling today? And I'll ask him when was the last time he voided. When was the last time you voided? Okay, which caused the reason for a Foley catheter. Okay, have you ever had a Foley catheter before? He says yes. All right, then I will now put on my clean gloves. Make sure that I ask my patient if he's comfortable. Make sure the bed is in the correct working height. And then I'll push back the blanket, covering the patient's feet just to make sure that he's still feeling warm and not cold. Then I'll put my patient in the proper position. Go back his gown a bit, covering his abdomen to keep it privacy. Then I'll examine the perineum area just to make sure that it's clean. If it needs any cleaning, then I'll clean it. Go over here to my wipes. We'll start with the outside area. Perineum. Then I'll pat dry the patient. Are you feeling okay, Mr. Livingston? Alright. Okay, after that is done, then I'll go for my kit. Take it out the bag. Then I'll put the bag at the end of the patient's bed. Make sure I tell the patient that it's at the end of his bed so he doesn't move to contaminate my sterile food that I'm about to set up. So this bag will serve the purpose of easily throwing in garbage. Then I'll take my kit over to my patient's bed, carefully place it down, then I carefully just open it, touching the outside. And after that is done, then I will remove my clean gloves. After removing my clean gloves, I will now go on to putting on my sterile gloves because it is a sterile procedure. I'll use my non-dominant hand to put the first glove onto my dominant hand. After that is done, I'll use these two fingers and then carefully glide it onto my non-dominant hand. After that is done, then I can fix the rest. After my gloves is on, then I'll keep my hands above waist length. Then I'll go over to my patient, my sterile field, and carefully extend my sterile field. Get my absorbent pad. Place it under my patient. This part over my patient's perineum area. So after that is done, then we're going to set up everything else that we'll need. So we'll need our swab sticks. And we'll make sure that the patient is not allergic to iodine or latex before we even start this procedure. Then we're going to take our syringe and our lubricant. Place some lubricant. Then now we'll insert this 10cc syringe to make sure that the balloon works. Now that we see that the balloon works, we're going to allow gravity to pull back all that fluid. Okay, so once all that 10 cc's of fluid is back, then we can drop that right there. So now we're going to lose sterility of one of my hands. I'm going to hold the shaft of the penis and clean the area. I'm going to start from the inside. Once we get that done, we're going to lubricate the tip of the catheter. Lubricate it well. Then we're going to hold the penis and carefully insert. And I'm going to tell the patient to inhale and exhale, and upon exhaling, I'll insert the catheter. About 6 inches, or up until I see urine return and no resistance. And after that, after I see urine return, then I will hold it and inflate the balloon. After I inflate the balloon, then I'll carefully remove the syringe and pull back until I meet resistance. After that is done, then I'll carefully make sure the catheter is not tangled. And in some hospitals, it will be taped to the patient's leg with some bit of resistance right here, and it will be hung to the side of the patient's bed. If a sample is needed, then at this point we'll give a sample to put the sample in this and send it to the lab. And that's the insertion of a Foley catheter. We'll also put the date and time the Foley was inserted and my initial. So now how to remove a Foley catheter. So removing a Foley catheter is not really a sterile procedure, it's a clean procedure. So I'll go ahead and take off my sterile gloves. Do hygiene. And I'll put on my clean gloves. And after the Foley procedure, you take up all your things that you use for the procedure. But for this video purposes, we're just showing the insertion and removal. Same time, but in a hospital setting, you would insert and then get rid of all of this. So we'll make sure we have our syringe, which is 10 cc's of what we inserted inside the patient. We'll have our clean gloves. We have the absorbent pad underneath the patient just in case anything runs out. We'll remove the tape if the Foley was taped to the patient's leg, and we would then insert the catheter, the syringe onto the catheter, and then gravity should pull back all the fluid that was inflated inside of the balloon, and we should get back the 10 cc's of fluid that we inserted. Okay, after all that fluid has came back, we carefully twist it off. Then we tell the patient that we're about to remove the catheter and ask them to inhale, and then exhale. Upon exhaling, we do 1, 2, 3, remove it, carefully wrap it inside the gloves because we don't want any flashback. And then after that, we'll carefully clean up our area, and that is how you insert and remove a Foley catheter on a male patient. Thank you.